Welcome to the Children and Family session. I look forward to spending the next 40 minutes with you and share a little bit more about Levy and how we can help you navigate some of the challenges resulting from this COVID-19 world. As I stated in our introduction, we will set aside time at the end for questions. But we do welcome and encourage you to put any questions or comments into the chat, and we will be posting a poll to get information back from you. And at the end of the session, in our closing remarks, we'll also be putting a link to a survey that's a little bit longer where you can provide more in-depth feedback. Next slide. So just to share another story about how Levy makes a difference, I just cannot say enough how grateful I am to the Denver residents and their generosity that comes from the Levy property taxes. Every day I get to be a part of a team that helps facilitate supports and services, and even might say miracles, to improve the lives of children with developmental delay or intellectual and developmental disability and their families. One mom recently shared how an individual request submitted for a trampoline has made a big impact on the life of her son and family. Not only does this trampoline provide an outlet for recreation and fun, but it's helping this boy gain independence and provide a safe break from his mom. What a difference this has made in their new normal. He definitely looks like he's thriving and not merely surviving. I just had the opportunity to introduce you to our Levy operations team. In addition, I'd like to introduce you to two more team members that work directly with you and your children in accessing the Levy program and navigating this often complex system. Next slide. First, I'd like to introduce you to Shannon. She's our early intervention engagement specialist, and I'll let Shannon introduce herself more fully.
Thank you so much, Amy. I'm excited to be here today to talk to you about how Levy is supporting and enhancing early intervention services. A big part of my role as the engagement specialist, kind of in the name, is to increase the engagement of the families, providers, and community partners during all stages of the early intervention program. We're working to do this by involving staff, families receiving services, community stakeholders to identify needs, gaps, and barriers, starting at the time of referral and going all the way through the age of 3 when children are aging out of our program, to improve the services and supports to enhance the experience for all participants in our program. We're taking the information that we are learning and identifying these needs, gaps, and barriers to develop programs and supports Levy to best meet the needs and enhance the services provided by our EI program. A Levy program that some of you might be familiar with is the Early Intervention Unmet Needs menu. And this came about through the process of identifying needs and then utilizing Levy to provide access to many of the wonderful opportunities that are included on this menu that is not provided and offered through early intervention on its own as the state program. Within the Unmet Needs program, we're able to order toy and book packages as environmental supports for children in our families. We're able to order baby furniture that includes cribs and high chairs and strollers. We're able to get home safety items to lock up those cabinets and toilets where those little ones might be trying to get. And we've also been able to contract with companies in the Denver area that provide music classes. And we've been able to cover the registration so that our children and families can participate in a fun, social, and recreational program through those music classes. As Amy has said, COVID-19 has presented a lot of unique and new challenges that has made this work even more important. And we'll continue to engage with all of our stakeholders as we strive to provide easier access to supports and services to help meet those diverse needs of the children and the families in our program.
Thank you so much, Shannon. I am now going to introduce you to our supervisor in our family services and support program, and she'll tell us a little bit more about our children's coordinator and DPS liaison role. Kristen, do you want to introduce yourself and Julianne?
Yes, thank you. Hi, my name is Kristen Syracusa, and I am now the former Mill Children's Service Coordinator. The Mill Levy program is always evolving, and Julianne Subi, who you see on your screen, who is on the call as well, will be starting in November as our DPS liaison for Rocky Mountain Human Services. She'll be available to navigate support availabilities relating to Denver Public Schools and the Mill Levy program in the next few weeks. So thank you, Julianne. The DPS liaison provides education about Rocky Mountain Human Services Mill Levy services and how to apply according to your child's individualized needs. They also provide options counseling to families and improve supports around those just entering school between those 3 to 5 ages, the transition age of 14 years old, and those 18 to 21 years of age who are prepping for the real world. The DPS liaison organizes any internal efforts when it comes to Denver public schools, such as communications and outreach, and intake department efforts. They also plan and coordinate and monitor Mill Levy funded services provided for children between the ages of 0 to 18 years with developmental delays as well as developmental disabilities who are Denver residents. The DPS liaison helps identify and navigate family needs that may not be covered under private insurance and Medicaid. Some of the common Mill Levy funding opportunities include professional services, sensory items, developmental supports, beds, swim classes, safety items, and contracted supports such as the music class that Shannon had mentioned before. That DPS liaison coordinates communication with Denver Public Schools to support families in receiving ample individualized education plan or IEP guidance, funding, and educational supports. Thanks for your time.
Thanks, Kristen, and welcome, Julianne, to the team. Next slide, please.
Thank you.
So there are, Kristen and Shannon both touched on this, but there are a couple of ways that you and your family can access Mill Levy funding. We are able to offer service and supports that are not covered fully by early intervention services or the Family Services and Support Program. They kind of highlighted some of those examples, but just to review, some of the common things that we can provide through a Mill Levy service plan are adaptive equipment, durable medical equipment, dental and medical costs, evaluations and assessments, recreation and exercise, caregiver parent training, car seats, safety items, and cribs. Individual requests is the second avenue in which you can access Mill Levy funding. These requests are just as what the name implies. They are individual. You can work with your service coordinator or submit a request through our website. If you go to the website under individual and families, there's a form that can be filled out online. If you need assistance with that, there's also a contact information or an email address that you can request assistance to fill those out. Individual requests are examples we've been sharing tonight. They are completely individualized to meet very specific needs that are unique to your child and your family situation. And so there's really not a menu of services related to individual. They're just simply that, individual requests. Next slide, please. We could have never imagined, like I said, what this pandemic would do to our lives, and in particular the lives of children and families that we provide services for. It's practically overnight, our services were halted in the way that we could provide them. What we found was what we always say about Mill Levy is how flexible it can be, how responsive it can be, but that was really put to the test as we've gone through this pandemic. And what we learned was what we always suspected, is that Mill Levy can identify needs quickly, adapt, and execute to get the services to the family quickly. We had to respond very quickly to COVID-19 in different ways for our adult services and our children's services. And Shannon's going to highlight some of the ways in which we took swift action to put things in place so that there'd be as little disruption as possible in a state of chaos and disruption that was all around us. Shannon, do you want to kind of talk through some of those things?
Of course. Thank you, Amy. Yeah, one of the biggest challenges and changes that we came across was moving all of our evaluations and services for early intervention to telehealth. And one need that we identified was sometimes having a tablet or device that the family can use to access an evaluation to get involved with our program. So we were able to use Levy funding to purchase tablets and devices for families who identified that as a barrier or a need in order to access the evaluation and and services through our program. We also looked at, we had our unmet needs for early intervention, but we found that families weren't having access to the same recreational activities, especially over the summer, as they had in the past. So we were able to, again, use Levy and collaborate to put together a boredom buster package that was available to families and provided both indoor and outdoor fun activities that families could do with their young children. And we also saw a decline in our referrals because families weren't able to go to the doctor and access their well child visits as regularly and frequently as they had before COVID. So we've done a lot of connecting with community organizations and have done presentations for different support groups and informational meetings so that families have the information to be able to access the evaluation and while they might have some limits with how often and when they're seeing their pediatricians, where they typically get referred to our program.
Thanks, Shannon. Next slide. As I've talked about in the introduction, Levy funding is not new, and most of what we've talked about up to this point has really highlighted things that have been in place. We've had Levy service plans in place, we've had individual requests in place, but as we've worked through the last 6 months of adjusting and identifying, adapting, and executing within this new normal, we have sought feedback from families, community agencies, and advocacy groups to identify specific needs that have really become to light and that are relevant as a result of this new normal. So I'm pleased to now turn the time over to Abby Grinstead, one of our Levy program development specialists and our team's resident expert in individual requests. She's going to walk us through some of those supports that are available now to help you go from merely surviving to thriving in your new normal. Abby?
Thanks, Amy. Good evening, everybody. As Amy shared, I'm Abby Grinstead in the Levy team, and I really want to just kind of check in with you. How are you? Like, really, how are you? Are you like most parents right now who are really struggling at this time with everything that's going on? I know that you're worried about your kid or your kids. The expectations are confusing, and they are so much more than they should be right now. Levy is here to support you. Parenting in a pandemic. I think that phrase says it all. As a fellow parent of 2 teenage boys, I can definitely relate to the challenges of parenting in a pandemic. It's tough for families to keep a sense of calm, but recognizing the importance to help children feel safe, keep those healthy routines, to manage behaviors and build resilience. And this is where Levy comes in. Can you go to the next slide, please? We are proud to offer dependent care. So dependent care is a support that will empower you as a parent to be present with your child in their telehealth session, in their medical appointment. Dependent care allows you the funding to be able to bring in somebody that you know, somebody that you trust, which is ever more important during this pandemic time, to be able to watch your other children know that they are safe, know that they are cared for, so your time and attention can really be present in that telehealth session, can really be present in that medical meeting that might need to occur via technology these days. And so dependent care was born out of this need of understanding that parents need that support so that way their attention can be right there with their little one or with their older kiddo as they're going through this new normal of understanding services during a telehealth session. Can we go to the next slide, please? Likewise, mirror to that a little bit are our education supports. As I said, parenting and a pandemic. Parents are wearing so many different hats these days and trying to manage so many different schedules that right now, whether your child is learning at home in a completely remote environment, or whether they are doing a hybrid model of some days in home and some days at school, it's a lot to manage all of that. And education supports were born out of that. So once again, to be able to empower parents to have somebody come into their home that they know, that they trust, to be able to support their learner, their child, as they walk through this new normal of receiving their education online or in that hybrid model. And so education supports are something that you can access right now in MilLevy to be able to provide your learner with the necessary supports and that one-on-one attention that they may need right now. Next slide, please. Education supplies. As many people are settling into this new normal, as Amy has shared, whether that's working from home or entering into this brave new world of distance learning, whether it's that mix of in-person or completely remote, just because kids are no longer in the classroom doesn't mean that they no longer need those classroom necessities. MilLevy recognizes that, and we are here to support that need. We are that environment that both fosters that normalcy and ensures kids have the supplies that they need to complete their work. Whether that could be headphones, whether that could be a tablet or a laptop, whether that's a water bottle that they can have as they are looking at this computer and being there. If your kiddo or child is doing a hybrid model and they have some days at home and some days in school, their supplies might look very different right now than what a typical back to school year supply list might entail. And we recognize that. So some of those supplies might include some personal protective equipment, such as masks, a supply of masks. So you don't have to figure out, how do I wash this mask every day to ensure my child's safety at school the next day? We can supply masks for that week, so you have enough for that week. Once again, a water bottle or sanitizer, or perhaps even a bag to be able to carry all of these supplies in, so that way your child, your loved one, is safe in this new hybrid model of school. Next slide, please. We are proud to offer Homemaker Services. There are only 24 hours in a day. Did I mention that we are parenting in a pandemic? Investing those hours smartly is constantly something that we are focusing on. How do we support you as parents and caregivers here in the MilLevy team? Your priorities are constantly shifting from taking care of that house and running that, to possibly working from home, to being your child's teacher at times and helping them navigate this new normal as you're navigating this new normal for you, and a schedule that might possibly be changing day to day or week to week as we're getting new updates in our community and new updates from our schooling. Fatigue and lack of time happen. Studies show that the connection between the cleanliness of your home and well-being of your family are very closely linked. Stress level, physical health, mental health, MilLevy is here to support you and having a clean home that is ready for whatever that day might bring in your new normal. Whether you're a person that really would benefit from having a deep clean once a month, and you can take care of those kind of day-to-day, week-to-week tidying up, but having that clean slate to start from really empowers you as a parent to embrace what is coming next. Or perhaps you're a parent that, I don't really need to worry about that deep clean. It is the day-to-day, that week-to-week kind of tidying up that I really would use some support with that. And that would go a long way in ensuring that I have a home environment that's conducive to that learning, that's conducive to the well-being of everybody. In addition to the Homemaker Services of being able to offer that clean house, we also recognize that meal planning would likely also be a support at this time. Being together at the table is an important chance to celebrate being a family, and Mill Levy is here to help support you with that. Family meals are for nourishment, for comfort, for support, and food is always better eaten with the people that we love. So how does this look in our homemaker services? Meal planning services. Imagine in those 24 hours that I talked about that we only get as a parent in a day, and how do we invest that wisely? We want as many of those hours to be spent with your family, with your loved one, with your child, for yourself to refine your center. So if you can have meal planning, so you know that a week's worth of meals or longer are planned out, ready to go. These meal planning services will even go so far as to provide a shopping list for you. So once again, you can maximize your time when you are in the grocery store. This way, it's not getting to the end of the day. And if I can relate to you as parents, I know sometimes I'm like, oh, it's dinner time. Okay, now what's next? What do I do? What do I have in my cupboards? What do I have on hand to throw together for a meal that will be something that we can enjoy and be healthy for all of us? And that is where meal planning services in our homemaker services can really be there as a support for you. Next slide, please. Snoopy shares that the secret to life is to always look up. I want to share about Romero. As you can see from this picture, Romero is absolutely glowing. Mill Levy and those individual requests were able to be there when he needed that support the most in shoes that he could learn to put on himself. Special shoes helped Romero to be able to gain that independence, to be so proud of the fact that he did this and he was able to put his shoes on himself. And so I'm so excited to be able to share that with you, that even in the midst of parenting in a pandemic, we can keep looking up. And Mill Levy is here for all of you in your time. Thanks, Amy.
And I just want, I want to open up some time for questions and feedback. But I also just want to do a shout out to the hard work that our service coordinators do to keep up with the rapid response of Mill Levy. So as we've talked about, a lot of these things have been available, but we're also implementing a lot of new things. And I said, these are available now, the things that Abby just went over, but also recognize we're throwing a lot of this at your service coordinators too, that these are new programs and processes. So be patient. And if you're running into any obstacles, please reach out to our email address on the website, or to your service coordinator, and we will help them navigate that as well. Because we're all finding a new normal, right? And so I just want to just kind of do a shout out to our service coordinators. We know that they work hard and try to keep up with all of these rapid changes as well. So now we want to just give kind of find out who's here and open this up to some questions or feedback. And so if you want to put that into the chat or unmute yourself and turn on your camera, we would love to see who's here. No questions, no comments, feedback?
Well, hi, my name is Chrissy. Can you hear me?
Yes, we can.
Okay, I wasn't able to get on through Teams, so I just caught it from on my phone, so I didn't get to see the slides or anything. But I do think this is a really helpful program, just giving feedback, and it is just for those who have a intellectual or developmental disability, right? And does that have to be like, do they have to have some type of something like from the doctors, or?
Abby, do you want to answer that?
Thank you so much for joining us by phone and taking the time out of those busy 24 hours to be present with us. That's a great question. So yes, Mill Levy funding is available to residents that live and reside in the city and county of Denver and also have an intellectual disability or delay. And so it is kind of multi-step process a little bit, whether you're coming into our intake and you're interested in one of our programmings, depending on the age of your child. That could be early intervention, it could be family support programming, it could even be a Levy programming that would be with Julianne as that DPS liaison. And so some of those questions depend a little bit on your needs and the age of your child. Does that help answer a little bit?
Yeah, and actually, I'm just joining. I'm an intern at DHS, so I just wanted to join in to learn more about it in case or maybe who maybe have questions about it, or I could direct them to this program. So I'm just trying to make sure.
Yeah, absolutely. I think that's great, and it kind of applies to one of our questions in the chat about how to refer those people to us. So if you come across someone that is a Denver resident that has a developmental delay or a developmental disability, they do not have to already be affiliated with RMHS. They can go to our website to the Levy Services tab and submit individual requests there, and it has our contact information. As well, but if they are affiliated with RMHS already, the most efficient way to access the Levy services and supports is through working with their service coordinator. Certainly, they can contact us directly as well through the online application. The process in which it flows once we get that online application is we will work to get that assigned to a service coordinator. We have a multi-tiered review process to make sure that we're aligned with the rules and regulations and to be in compliance with our contract with the Department of Human Services and the city accounting requirements. And so we do have a multi-tiered approval process. It's very efficient. And we currently do not have a specific flow chart on our website to direct people through that. I have gotten that request a little bit in preparing for this meeting of having a more condensed flyer or a one-pager, and so I'll be working on responding to that need with our communications department. And in terms of and so yes, please, if you have someone that meets that criteria, send them our way. The other question that's in the chat is, do we have a list of these new services that are in one place? In the presentation, we met with our teams internally a couple of weeks ago to let them know that these are newer things that we're offering. So this is the interesting thing about Levy. It's not that these are necessarily new. It's more that we've identified these as more common needs. Levy has always been so individualized, but when we recognize that more and more people are asking for the similar type of service, and we feel that it meets the requirement for Levy, then we can present it more as like, this is a new service. So it's not necessarily new, but yes, we're putting it out there of like, maybe you didn't know that this is something that Levy could do to support you. So right now, this is being presented at the community forum, and our presentations will be, and they might even already be online. And that's something that we can look at putting on the website as well. On one of our slides, we listed a few resources. You do not have to use these particular resources. These are just ones that we researched that kind of fit the parameters for what we're able to offer. We need to be able to pay the vendor directly. And Abby, maybe you can talk a little bit more about that. Abby did a lot of research. And so no, you don't have to use these vendors, but we also are putting it out there that these are some that we've researched. Abby, do you want to talk a little bit about that?
Absolutely. Thanks, Amy, for that. We recognize that when we're talking about some of these services that we have been able to do, but we're certainly highlighting them now in this time of heightened need as we're parenting in a pandemic. We also wanted to be able to provide some resources so that way you could go ahead and access these right away, where it wasn't something that then you had to find a resource on top of a house cleaning company on top of this in an already busy time when you might need something like now. I might need these meal planning services as of today because what you just described sounds amazing to me and I could use that. And so e-meals is one that works wonderfully, like with Amy had shared, that we can pay that vendor directly, and we can be able to go ahead and get that kind of membership going for you right away. Same with the house cleaning services. Many companies will need to meet with you first and be able to come out and kind of do an assessment of the home, and it can kind of be a little bit longer process to actually getting that service started. And so the ones that we highlighted here really have a streamlined process for being able to get those services going for you. And that way, once again, it's just not this, I need this now, and now I have to wait even a little bit longer. And so that's why we wanted to provide some resources, but feel free to choose whatever meal planning service might meet your needs the best. That's the great thing about Mill Levy, as Amy has shared, it really is designed to meet your child, your family's needs right where they are. And so certainly you don't have to, but hopefully these are helpful supports or resources that we've provided.
I have a question in regards to respite care. It has been wonderful, and especially during this pandemic, I've been utilizing my respite. And so for respite for the year, is there a cap on it? Because I feel like I'm using it like every Saturday because I have someone who is socially distancing so that she can spend some time with my son, taking him out, and so and so my question is respite a quarterly, or if I'm using it, I'm using the respite, and so I feel like it's running out. So if I don't usually have enough money in the fund, so requesting it additional, is there a cap on respite on a yearly basis?
That's a great question. Amy, did you want to take that or do you want me to?
Yeah, I can go ahead and take that, and I'm going to have Paige jump in as well. So we've actually been talking through this. So again, Mill Levy allows for a lot of flexibility, and we set some parameters around respite, mainly to keep us in check with our overall Mill Levy funding. So that's one. The beauty of Mill Levy is that we do get those funds. One of the constraints is it is a finite number each year. And so we are managing to our overall budget. And so we set some parameters in place around respite requests, more so to look at where we are in alignment with our overall budget. And so the approval process for that goes through our program manager, and I work closely with Paige on any requests that begin to exceed what we've put in as parameters. But the real issue is whether or not it's meeting that need, and if we have the funds available to provide that. Paige, do you want to add anything to that? Sorry to put you on the spot, but you're here.
That's okay. Hi, everyone. I'm Paige Martin, the Family Support Program Manager. Yes, there are limits. They're over a 6-month period. So right now the limit is for July through December. And then, as Amy said, we reevaluate according to the next calendar year Mill Levy budget. And then we work within those new budget parameters. It's also in alignment with your child's most in need score, or if you're the parent of an EI child, it's the level of need. Does that help?
It does. However, in the case of like everyone's situation is different. And so, my son is 17 and, the weekends are hard, because as a family, we can't go out. And so, in terms of his mental health, the respite has been wonderful for us because I have an opportunity because we're doing remote learning. I'm doing remote learning with him. He has those needs. So when you talk about the SIF scale, isn't it changing, with COVID because mental health and so forth?
Did you just say CIS?
Yeah. The scale, is it the SIF scale?
That's actually the scale used for adult programs. 18
oh, sorry.
That's okay. No worries at all. It's just a lot of things in each program, right, to learn. And you know what it might be nice to do is for you to reach out to your service coordinator, who can then talk to me and we can see where you are with your limits so far, because you also have state funds access to that too.
Okay, I appreciate it. Thank you so much.
Of course. Who is your
And
service coordinator? Do you mind if I
it's
ask?
Brittany Click. And
Perfect.
she's
Okay.
been wonderful, and the mill levy has been very wonderful to us. You know, I do want to say that it's really not only improved my life, but it also improved William's life, because he's able to interact outside of the family, and he needs that, you know, and as we are transitioning, you know, to adulthood, because, you know, he's going to be he's next year he'll turn 18, so, you know, we are transitioning to the adult as well.
Right, right. I will let Brittany know that you'll be giving her a call so you can talk about that more and we can see where you are with your limits and budget. How does that sound?
That sounds great. Thank you so much.
Oh, you're welcome.
How come I can't see nobody when they're talking?
I did not turn my camera on. I apologize.
Oh, I can't see nobody when they're talking.
Oh, you can't see
Here.
me right now?
I just see AB now, and then the other one was, I can see you now. I can see you now.
Okay, good. Hi.
Hi, Angela.
Hi. Hello.
There's a question, Amy, in the chat. Would you mind if I answered it?
Sure.
Okay. So great question, Dominic, with regards to the Home Chef or Sunbasket. I'm not as familiar with those as meal planning services, but absolutely, if they are a meal planning service you're familiar with or have utilized, we certainly would be able to use that with this Homemaker Services that we are offering. If they are a home meal delivery service, we have recognized, due to this time of pandemic and need of COVID, that there are some very kind of rare circumstances where somebody who is sick, actively symptomatic with COVID, that might need to have a little bit higher level of support. And so if there's any of those needs, if those Home Chef or Sunbasket lead to more of those, certainly talk to your service coordinator if you're connected, or put that request through that through the website, through the external request process, and we can take a look at that. Thank you for that question. Does that help answer it? Any follow-up with that?
And so if I give an example of how emails works, one of our examples. So the meal planning, they would give you ideas and put together the shopping. They are affiliated with all of the local stores, Safeway, King Soopers, Walmart, all of the major grocery outlets here in Denver. And then that order could be submitted and either delivered to your home, not the food, but we don't pay necessarily for the food portion, but for the planning and to put that request in and have it ready for pickup. And if they offer that delivery, but not paying for the actual food. So that's kind of the distinction on the meal planning.
Absolutely. And one of the, I believe I'd have to go back to our slide, but the other one that's listed as the meal planning resource, they will also, you can enter in what ingredients you likely have in your pantry at all times. And so when they're doing that meal planning process, they will take into consideration what you already have on hand in your pantry or your refrigerator, that then go towards your likes, but also a cost saving of not having to go and get additional ingredients for the different recipes. And so I liked that also. So there are some different distinctions between those as well.
So if you have questions about your specific needs in regards to the Homemaker Services and specifically around meal planning, reach out to your service coordinator, because as Abby said, and how Meal Levy works is it's extremely individualized, and we can look at if that meets the criteria to meet your specific needs. And so we encourage you to do that. Okay, it looks like we're getting close to our 7 o'clock session. We have a couple of more minutes before we go into the Spanish version of what we just did. Are there any last questions?
I have a question.
Okay.
I'm in the process because my daughter's an adult now. She just turned 18 in April. So I'm in the process of getting a guardianship, and I was told that some of the mill levy I can ask Denver, Denver Options, Rocky Mountain Human Services, if they can help out. Do you guys help out on that?
So we have an external partner, CCDC. Oh, I always mess up their acronym. Yeah, CCDC, I'll look it up, is one of our external partners. And part of their scope of work is to assist people with the guardianship, the paperwork and the filing around guardianship, as long as it's uncontested. And so we can certainly connect you with them as one of our external partners to the extent of what they would be able to support you with. Sorry, you froze.
I have a quick question.
Okay.
So this program is it for just like kids with disabilities, or with also parents if they have a disability as well?
So the Mill-Levy program is available to any Denver resident that has a developmental disability or a child with a developmental delay. Once that criteria is met, then that really is the basis for the Mill-Levy funding. If the adult has been determined IDD, then yes, we were able to welcome those requests. If the adult has not yet been determined IDD or the child, they can go through our intake process, and there are some services and supports that can be provided to the person that's seeking eligibility.
Okay, awesome. Thank you.
Okay, please put any additional questions that you might have into the chat, and we will do our best to address them, and depending on the volume of questions we have, include them in our links to the tonight's presentation in the form of FAQs. So thank you, everybody. And just as a reminder, this next session will go to about 7:45, and then we will come back onto the same main link just for closing remarks and any wrap-up questions and feedback. So thank you for attending, and if you are here for the Spanish sessions, please stay, and we'll give those individuals coming for Spanish a minute or two to log in. Si están aquí para la sesión de español, por favor, quédenos con nosotros y vamos a empezar en unos minutos para darle la chance de llegar los que hablan español.